I think absolutely. As you're aware, we've had some great results with Tagrisso already in the metastatic setting. So we had great promise about really bringing it earlier into the disease paradigm. And when we look at the ADAURA study, this is very much earlier into the potentially in the longer term curative setting, which is in the early stage 1B up to 3A. These are the resectable populations. So what we've been able to demonstrate is compelling. I mean, any study that stopped 2 years early has to be done for a very good reason, as you can imagine. So this data is compelling in terms of the disease-free survival benefit we're seeing. But it's important for a number of ways. One, it's telling us that you hit it early, hit it well, you can have very compelling results in lung cancer. The second is some of these patients, while they all had surgery, not all of them had adjuvant chemotherapy. So about half of the patients had chemotherapy, half didn't. And regardless of that, you're seeing significant benefit. So you're seeing, in my view, there will be a paradigm shift. One, it may drive people to want to identify disease earlier, which is really important. Two, I think you'll see this is becoming standard of care in this earlier stage adjuvant setting. And three, there's a whole question, do you also need to give chemotherapy? And again, we don't have enough data, we have to wait for overall survival data, etc. But I think those three areas are areas where we'll see very significant changes in clinical care. So after ASCO, and I think I'll touch on some of the things I already said, in the frontline metastatic setting, which is the late stage disease, stage 4, we have seen great results with Tagrisso, and it really has become the standard of care for all intents and purposes. What we're seeing now, and as AstraZeneca, we're very much committed to really eliminating cancer as a cause of death, and we do understand the best chance of achieving that is to treat early, identify the right patients early. This is what ADAURA is allowing us to do. Treat patients early. Now, if we think about the stage 1Bs, are pretty early lung cancers, right through to stage 3A, that's a broad group of patients. But if you look at those groups individually, we're seeing benefits in each group. So this is incredibly compelling for physicians now to be able to treat their very early lung cancers, which would probably have a good chance of cure with just resection, but still a huge proportion of these patients will relapse. So this is, for me, it's going to be a huge change in clinical care.